great to welcome all participants of German-Ukrainian Autumn Schools 2021 in Kiev and in Kharkiv. I would like to present for your attention lecture, Nanocomplexation of chemotherapeutic drugs for improved anti-cancer efficiency. And thank you very much for Anna for Harman introducing for me. But on this slide you can see short information about me. I am Doctor of Biological Sciences and the head of Department of Plant Physiology, Biochemistry and Bioenergetics at National University of Life and Environmental Sciences in Ukraine. And this year I moved from changed my workplace and moved from Tarashchenko National University to National University of Life and Environmental Sciences of Ukraine. I'm expert in the fields of biochemistry and nanobiotechnology. So, chemotherapy remains one of the most effective anti-cancer treatment, but therapeutic efficiency is limited by low selectivity of drugs, development of multi-drug resistance in cancer cells, high toxicity, for example, hematotoxicity, cardiotoxicity, hepatotoxicity, nephrotoxicity, and other, side effects, for example, paraneoplastic syndrome, cachexia, and anemia. Cisplatin is a metal-containing alkylating drugs, and it's widely used against malignant tumors of various origins. For example, lymphomas, cancers of the brain, breast, lung, ovarious, and other cancers, and cytotoxic effects of cisplatin is determined by DNA damage and extranuclear targets accompanied by reactive oxygen species production and induction of oxidative stress. So, complexation or combination anti-cancer drugs with nanoparticles will allow to enhance anti-tumor activity of drugs and to reduce of its side and toxic effects. In this respect, carbon nanomaterials, carbon nanostructure, in partially fullerene C60 with unique chemical and physical properties are of considerable interest. C60 fullerene is a molecule with 60 carbon atoms, 0.72 nanometers in size, spherical in forms and hydrophobic. Due to molecule C60 can interact with biological molecules and integrate into lipid bilayer of cell membrane. Molecule fullerene C60 can present it as stable aqueous colloidal solutions, and carbon nanostructure fullerene C60 consists of system of conjugated electron deficient double bonds. Due to C60 fullerenes has antioxidant properties, scavenge free radical. C60 fullerene can be photoexcited by irradiation in ultraviolet visible range and produce reactive oxygen species that can be used for photodynamic therapy. And also C60 fullerene can form complexes with chemotherapeutic drugs that can be used for optimization anti-cancer's activity and biological activity of drugs. So the aim of our study was to create nanocomplex of fullerene C60 with cisplatin, to characterize C60 cisplatin nanocomplex by physical and chemical methods, to investigate anti-tumor effects fullerene cisplatin nanocomplex in vitro and in vivo in comparison with free drug, especially cisplatin. The task and workflow for elaboration of nanocomplex of fullerene with cisplatin included the following stages. 1. Computer modeling of non-covalent cisplatin fullerene nanocomplex. 2. The fast and cost-effective preparation of fullerene cisplatin nanocomplex. 3. The analytical assessment of fullerene cisplatin nanocomplex stability by using physical and chemical methods. 4. The evaluation of cytotoxic activity fullerene cisplatin nanocomplex and cisplatin-free against Lewis lung carcinoma cells. And 5. The evaluation of anti-tumor activity of fullerene cisplatin nanocomplex again in mice with transplanted Lewis lung carcinoma in comparison with free fullerene and cisplatin. In the study was used Lewis lung carcinoma cell lines, the transplanted model of Lewis lung carcinoma, the stable aqueous colloid solution of pristine C60 fullerene was synthesized at Nanotechnical University Germany, and cisplatin, Sigma USA. In this studies was also used following methods. Methods of cell biology and cytology, for example, cell culturing, staining of cell, light and confocal microscopy, spectrophotometric methods, NTT assay, caspase-37 activity, dynamic light scattering, scanning tunnel microscopy, computer modeling, methods of toxicology, for example, determination of the semi-lethal dose LD50 value, hematological parameters, methods of experimental oncology, transplantation of tumor cells into laboratory mice, determination of tumor growth and metastasis indicators, blood indicators, and survival of tumor-bearing mice, and also statistical analysis. Previously was shown that fullerene C60 prevented normal cells against toxic effects of hydrogen peroxide and cisplatin. It's known that hydrogen peroxide is cisplatin are inductors of oxidative stress and cause production of reactive oxygen species. The levels of reactive oxygen species was determined by spectrophlorimetric methods with fluorescent probe, dichloride fluorescein diacetyl, DCF. So you can see that hydrogen peroxide and cisplatin cause intensification of production of reactive oxygen species. C60 fullerene have no effect on the level of reactive oxygen species, and that after treatment thymocytes of rats with fullerene prevented hydrogen peroxide induced reactive oxygen species, and cisplatin induces of reactive species. So you can see that in combination per treatment with fullerene and inductors of oxidative stress, the levels of reactive oxygen species was increased. Also was, C60 fullerene protects thymocytes from damaging effects of hydrogen peroxide and cisplatin. Protective effect of fullerene is realized by antioxidant properties of the nanostructure and its ability to attach electrons. We also show that C60 fullerene accumulated and localized in leukemic cells. By using confocal microscopy, was found that C60 fullerene fluorescent labeled with rhodamine isothiocyanate localized in LOC cells and at 24 hour in incubation. And so intracellular accumulation of fullerene C60 into leukemic cells was determined by using confocal microscopy and immunocytochemical staining with mitochondrial dye meter tracker, nuclear dye DAPI, and fits labeled antibodies to C60 fullerene with green color, meter tracker you can see red color, and DAPI blue color. And also you can see that fluorescent signal of fullerene green is localized together with a signal of mitotracker together and mitochondria. So it was found that C60 fullerene is accumulated in leukemic cells and localized mainly in mitochondria. So the first task was to create a nanocomplex of fullerene with cisplatin and characterize its structure using physical and chemical methods. According to molecular modeling date, non-covalent nanocomplex of C60 fullerene with cisplatin in aqueous solution in 1:1 model ratio is a simplest molecule, but on the surface of fullerene cluster can absorb more of the one cisplatin molecule. The obtained nanocomplex fullerene C60 cisplatin is stabilized by non-covalent interaction, both electrostatic interaction between adsorbed cisplatin molecule and on the surface fullerene cluster that carries partially negative charge, and also hydrophobic bonds. We create and characterize the obtained fullerene cisplatin nanocomplex. So the fullerene aqueous solution and cisplatin saline solution were mixed in 1:1 volume ratio, equivalent concentration 150 mg per milliliter. This method is based on the ultrasonic processing of the mixture of fullerene aqueous colloid and cisplatin saline solution, equivalent concentration, followed by prolonged mixing of the magnetic stir for obtaining a homogeneous dispersion system. The structural organization of the obtained nanocomplex of fullerene C60 with cisplatin was determined by dynamic light scattering methods and scanning to nano microscopy. Scanning to nano microscopy analysis showed that size of nanoparticles of nanocomplex was 1.1 nanometer and was large in comparison with free nanoparticles of C60 fluorine, the size 0.72 nanometers, and cisplatin 0.75 nanometers separately. It is noted that nanoparticles of the obtained nanocomplex form a chain structure oriented in certain direction, that it confirms that about formation nanocomplex by self-assembly mechanism. So the final concentration of C60 fluorine and cisplatin is the obtained nanocomplex was 75 microgram per milliliter respectively. The size of nanoparticles of nanocomplex or C60 fluorine was determined by using dynamic light scattering methods. So you can see that fluorine solution consists nanoparticles from 40 to 100 nanometers, but predominates nanoparticles with 80 nanometers. With hydrodynamic diameter 18 nanometers. In solution of the obtained nanocomplex consists nanoparticles with average hydrodynamic diameter from 80 to 160 nanometers, but predominate particles with average hydrodynamic diameter 120 nanometers. The stability of the obtained nanoparticles in solution was determined by using zeta potential value. So it was found that zeta potential value for nanocomplex was minus 21.2 microwatt in comparison with zeta potential for C60 fluorine was low and equal minus 23 microwatt. It was found that the obtained nanocomplex of fluorine with cisplatin was stabilized during 3 months, that can be used for biological studies. A non-covalent stable in water medium nanocomplex of C60 fluorine with cisplatin was created. The complexation between C60 fluorine and cisplatin molecules was confirmed with the use of computer simulation, scanning to nano microscopy, and dynamic light scattering. So the next step was investigated anti-tumor activity of the obtained nanocomplex of C60 fluorine with cisplatin against Lewis lung carcinoma models in vitro and in vivo. Lung cancer is a common cancer in the world and has one of the lowest survival rates. For example, 26% of men and 17% of women suffer from this disease. It characterized by high mortality through metastasis, lung cancer in other organs, for example, brains, bone, organs of respiratory system, organs of gastrointestinal tract, and other. The next task was to evaluate anti-tumor effect of fluorine cisplatin nanocomplex in vitro in comparison with free drug in equivalent concentration and to clarify the mechanism of nanocomplex effect on malignant cells. So the as experiment model was Lewis lung carcinoma was used and in vitro and in vivo studies. At first was investigated cytotoxic activity of the obtained nanocomplex against LLC cells. For estimation cytotoxic activity was used the entity assay spectrophotometric methods, which is widely used for cytotoxic activity of different chemics and different compounds. So you can see that using entity assay, you can see time and concentration dependent decreasing of LLC cells after treatment with cisplatin and the obtained nanocomplex of fluorine with cisplatin. So at complexation of cisplatin with 60 fluorine enhance cytotoxic activity, and so you can see that cytotoxic effect of the obtained nanocomplex was more powerful at 24-hour incubation, 72-hour incubation in comparison with free drug, and manifested early in comparison with free drug. So C60 fluorine had no effect on LC cells viability. So you can see that 12.5 micromolar cisplatin had no effect on LLC cells viability, while after treatment LLC cells with nanocomplex shown 31% decreasing of LLC cells viability. AC50 value for nanocomplex was lower by 3 times in comparison with free drug at 24-hour incubation and by 4.5 times at 72-hour incubation in comparison with free drug. So we can see that at complexation, cisplatin with fluorine, cytotoxic effect against LLC cells enhanced. The next task was to investigate the mechanism of cytotoxic activity of the obtained nanocomplex, and we propose that cytotoxic effect of nanocomplex is realized by cell death apoptosis mechanism. For this was used such methods as caspase 37 activity assay, heat luminescence spectroscopy, and the content double stain cells with annexine, label fields, and propidium iodide by using flow cytometry, because the cells is marked as externalization of phosphatidylserine on the outer surface of cell membrane of different cells with signs of apoptosis. So you can see that cisplatin had no effect on caspase 37 activity in LLC cells at 4-hour incubation, and only minor activation enzyme activity was found at 8 and 24-hour incubation. While after treatment, LLC cells with the obtained nanocomplex of C60 with cisplatin, the activity of caspase 37 was increased by 2 times in comparison with free cisplatin in equivalent concentration. So we also see that after treatment LLC cells with cisplatin was for increasing LLC cells with late apoptotic signs. While after treatment with nanocomplex, and increase the content of LLC cells with late and early apoptotic signs. So the obtained result, significant activation of caspase-3-7 activity and accumulation LLC cells with signs early and late apoptotic signs confirms that cytotoxic effect of the obtained nanocomplex realized by apoptosis mechanism. LLC cells are high invasive cells and rapidly migrate rapidly migrate into lung tissue with formation and numerous of interstices. To assess migratory activity, we used the one-Helen methods in cell monolayer, and it was found that at 24-hour incubation, the scratch in the untreated LLC cells was pronounced narrowed, and the overgrowth was 28%. While C6-defullerene and cisplatin caused migratory activity, but the greatest anti-migratory activity was found after treatment LLC cells with nanocomplex, and the degree overgrowth was only 6%. The use of nanocomplex of fullerene with cisplatin allowed to reduce the toxic concentration of cisplatin for LLC cells, induce apoptosis, and more effectively inhibits the migratory activity of LLC cells compared to the free drug. The next task was to evaluate the acute toxicity of fullerene, cisplatin, and fullerene cisplatin nanocomplex after intraperitoneal administration into laboratory mice. So we shown and we get very nice result against toxicity, for example, carbon nanostructure fullerene C60. So high value, LD50 value for C60 fullerene was 721 milligram per kilogram, and confirmed absence toxic effect of fullerene in organism mice after intraperitoneal injection at lowest doses. LD50 value for cisplatin was 15.6 milligram per kilogram, but at complexation cisplatin with fullerene, LD50 value was increased in 2 times and was 36.1 milligram per kilogram. So C6-defullerene is a low toxic compound. In vivo, cisplatin toxicity at complexation with C6-defullerene was reduced. The next task was to evaluate in vivo the anti-tumor and anti-metastatic effect of the obtained C6-defullerene cisplatin nanocomplex on a model of transplanted Lewis lung carcinoma. So, LLC cells were intramuscular inoculated into the limb of each mouse. The treatment, namely intraperitoneal injection, 5 consecutive days with a day in interval was started on the second day after tumor transplantation. Tumor-bearing mice was randomly divided by weight into the following experimental groups. Control group. In control group, tumor-bearing mice intraperitoneal received saline solution. In C60 fullerene group, tumor-bearing mice intraperitoneal received solution of fullerene in a total dose of 3.75 milligram per kilogram. In cisplatin group, tumor-bearing mice received cisplatin saline solution in a total dose of 3.75 milligram per kilogram. And in nanocomplex group, tumor-bearing mice received nanocomplex solution in a total dose 7.5 milligram per kilogram. So, at first was estimated that tumor volume, transplanted tumor volume in tumor-bearing mice in all experimental groups. You can see that tumor volume increased in all experimental groups from 10th to 22nd day of experiment. After treatment, tumor-bearing mice in cisplatin, in fullerene, inhibit tumor growth, but the most anti-tumor effect was found after treatment tumor-bearing mice with LC cells after injection the obtained nanocomplex. So on the 22nd day of experimental days, you can see that tumor volume increased in comparison with cisplatin group tumor-bearing mice by 28% and by 45% in comparison in control group of tumor-bearing mice, untreated tumor-bearing mice. So, you can see also that after treatment our drugs and cisplatin and C60 fullerene increase the average volume of metastasis in the lungs of tumor-bearing mice, but at complexation cisplatin with C60 fullerene, anti-metastatic effects of drugs was enhanced. So the obtained nanocomplex of fullerene cisplatin after intraperitoneal administration into tumor-bearing mice more effectively inhibited the growth of Lewis lung carcinoma and the formation of lung metastasis compared to free cisplatin at the equivalent dose. The next task was to assess the biological state of tumor-bearing mice under treatment with nanocomplex on such indicators as the survival of tumor-bearing mice and blood parameters. So you can see that lifespan of tumor-bearing mice treated with nanocomplex was lower by 4 days in comparison with fullerene group tumor-bearing mice and 6 days in comparison with cisplatin group tumor-bearing mice. So the prolongation of lifespan tumor-bearing mice treated with nanocomplex was 32% in comparison with control group of tumor-bearing mice, confirms the effective therapeuticity of using nanocomplex and after complexation. of cisplatin with fullerene. We also show that hematological state and parameters of tumor-bearing mice treated with nanocomplex was better in comparison with other and experimental groups of tumor-bearing mice. So also nanocomplex prevented tumor-associated and cisplatin-induced hematotoxicity in tumor-bearing mice. So you can see that hematological indicators, for example, hemoglobin and red blood cells content and also lymphocytes was increased in comparison in such indicators in cisplatin group of tumor-bearing mice. Also, you can see that reduce the content of white red cells, like leukocytes, in tumor-bearing mice treated with nanocomplex. So, intraperitoneal administration of the 60 fullerene cisplatin nanocomplex prolonged the lifespan of tumor-bearing mice with Lewis lung carcinoma and normalized blood parameters. Certain results are confirmed the prospects for the use of fullerene in anti-tumor therapy to increase the effectiveness of anti-tumor drugs. We also showed that C60-fullerene enhance anti-tumor activity such chemotherapeutic drugs as landomicin, doxorubicin, and berberine. And you can see on the slide presented our results with using of the obtained nanocomplex of fullerene with doxorubicin, and you can see that cytotoxic activity of cisplatin at complexation with doxorubicin, cytotoxic activity of doxorubicin at complexation with fullerene enhanced cytotoxic activity against leukemic cells, Jurocat, a different line of leukemic cells, and also increased tumor volume in transplanted cells after treatment with nanocomplex fullerene with doxorubicin, and also was increased metastasis in lung tumor-bearing mice. Also, we show that enhancing anti-tumor activity, anti-cancer activity of berberine at complexation with fullerene, and you can see that anti-migratory activity was enhanced at complexation berberine with fullerene, and also cytotoxic activity was increased against LLC cells, Lewis lung carcinoma cells, and also increased tumor volume after treatment tumor-bearing mice with fullerene berberine nanocomplex. And also we show that nanocomplex C60 fullerene with landomicin also increased activity landomicin against the human osteosarcoma cells and human memory cells. The presented results were obtained in collaboration with Professor Olga Matuszewska and Professor Lyudmila Drobot from Paladin Institute of Biochemistry. Kyiv, Dr. Hennady Tidenko from Kavetsky Institute of Experimental Pathology, Oncology and Radiobiology, Kyiv, Professor Markus Fome and Dr. Anna Hrebinik from Technical University of Applied Science, Budao, Germany, and Professor Uwe Ritter and Professor Schaar from the Technical University of Ilmenau, Germany. Thank you very much for your attention.
Thank you, Svetlana. Maybe you, maybe Anna. You? Okay, are there any questions, please? I think we have time, yeah? Please.
I have many questions because actually the molecule of fullerene is very simple, and I was very surprised to see so many unusual properties. My first question is concerning the complex of fullerene with cisplatin. How much is the binding constant, and which experimental data do you have? How can you prove that you really have such a complex? So it's not just a mixture. How much is the binding constant?
We estimated and confirmed the stability of the obtained non-covalent nanocomplex of fullerene with cisplatin by using dynamic light scattering methods by zeta potential value.
So from zeta potential value, you will get just zeta potential, but not indication of the complex formation. And from DLS, you will get information on the size of large aggregates in the solution, but not more. And the question is, why you have the complex? What are the experimental data?
And also microscopy, electron microscopy, scanning tunnel microscopy, and also scanning tunnel microscopy. We used physical methods with high solution.
With scanning tunnel microscopy, you see just the structures. You do not see cisplatin. You cannot distinguish between fullerene without cisplatin and fullerene with cisplatin. And to indicate that you have the complex, you need experimental method which can distinguish between fullerene with platin and fullerene without platin. The question is, which method did you use?
We work in comparison separately cisplatin and separately fullerene, and the mixture in aqueous solution, colloid solution formation. In comparison, this results but size, hydrodynamic diameter, and also nano size and nano size by using electron microscopy. By stability, only we confirms the value zeta potential.
The values which you have got with electron microscopy, and also with other methods do not indicate that you can see the individual molecules of fullerene. You see larger complexes. And these larger complexes may be influenced by each amphiphilic compounds. If you make addition of the detergent, you will also get it.
No, we propose that in solution of nanocomplex, so it consists not only a single molecule, fullerene C60 with nanocomplex, and can consist the solution a lot of fullerene aggregates with C60, but predominate in this solution nanoparticles, single molecule with fullerene and with cisplatin. But we propose that in this solution can focus and not only single molecule fullerene C60, and also aggregates of fullerene molecules with cisplatin. But we have as a task enhance the activity, cytotoxic activity and anti-tumor activity after complexation of C60 fullerene with other drugs. And we worked experiments only in comparison, free fullerene, free drugs, and in comparison with obtained nanocomplex. And we change in different time, different concentration, but our proposed in confirms the obtained results. The obtained nanocomplex were obtained. Our results anti-metastatic, anti-cytotoxic, and we also shown that the obtained nanocomplex prevent cytotoxicity of drugs on the normal cells, but maybe it's dependent on the mechanism penetration of fullerene and drugs with cell membrane and intracellular localization between normal and tumor cells.
Even if you consider this biological experiments, let's consider that you will make experiment by the following way. You make injection first of the pure fullerene, and 2 hours later injection of cisplatin. It will be the same.
Yes.
The result will be the same for different.
We only started work with using fullerene for anti-cancer treatment, anti-cancer activity. We started with combination activity, combination action, combined action of fullerene with cisplatin, and we can see that we propose that fullerene have a time for penetration into the normal or tumor cells, but then we create nanocomplex, and was found that anti-cancer activity of nanocomplex is great in comparison with combined treatment of fullerene and drugs.
If you don't have direct experimental data which indicate formation of complex, maybe it is possible to say something from the results of computer simulation. How much is the binding energy from the computer simulation? If you have done it, you have integrated.
That's not enough. We need the money. Do money. With money, can prove that the molecular weight is just the weight of cisplatin plus cis. So it's clear that it is a real complex.
It's
very
but
we cannot tell exactly, of course, the binding concept. But it's at least the binding concept is as high as we need for at least performing the multiples.
And in the multiples that you observe, so simple, this multiples is possible to answer this question. Because with multiples you could see the complex and you could see also simple fullerene.
Yeah, sure.
And that you observe simple fullerene complex, it was only the complex and the solution. Or in the prop, it was also.
It was mainly the complex with small risks of unconverted, or let's say already decomposed. I don't know, parts of C6 and cisplatin.
This is very important, but I think
important
mention.
I'd like to also say cisplatin is challenging for other nanocomplexes, as with the C60 complex with doxorubicin and barbarin. We calculate binding based on the spectra. So with the titration and the concentration of the ligand is changing, we could calculate the constant binding. But for cisplatin is not that easy. For the constant of binding for the complex of C60 and barbarin is 60, 10 power of 3 more converted more than 1.
10 power of
60,
10
10
power
power.
3 liter per mole.
Yeah, and for the barbarin it's 10 power.
I remember.
But if it is 10 to 3, it means that the concentration which was used in the experiments, it was almost no complex, because the concentration was below 1 million. Yes, in biological experiments. As I remember, it was much below 1 million. It means that